Okay, foley and catheter insertion remediation, take 93. My sterile gloves just broke on my last attempt, so I'm going to try it with some regular gloves. I hope it works. We'll find out. Anyway, I'm going to start at the point of the sterile procedure. So we've done cleanup. I've performed hand hygiene. I produce my sterile kit. Bring my sterile kit out. I'm going to use this bag at about the patient's hip level for trash, for discard. I'm going to open my sterile kit, one flap at a time. Well, this is folded towards me. This is folded away. I have my sterile gloves. Unpackage them. I'm touching the outer 1 inch. I need to adjust them, put them in the right orientation. I'm going to start. I'm going to pinch this hand, pinch the cuff here. I'm going to insert my hand and then pull. I'm going to insert here. I'm going to hope the staying on the inside of the fold. Pull my hands up. My sterile now. I'm going to fix my fingers since my hands are sterile. I'm going to cover the patient. I'm going to tell them about the procedure and what we're going to do. Keeping my hands here in my sterile field. I'm going to take my blue pad. I'm going to instruct my patient to lift up their hips so I can put it under them. I do, they do. I'm going to now take my drape and I'm going to drape it across the patient's area. I'm going to take, using only the center of my hand, put that there. I'm going to take this hand, I'm going to spread out the labia and hold it, and I'm going to clean one outer, one near, and one down the middle. I'm going to explain to the patients that there might be a pinch, or I might feel a little bit of pain, or it may be an awkward feel to breathe deeply, and we'll be done as soon as possible. Patient agrees, so we proceed. Still holding this, I take my catheter, I dip it into my opened lube, and I'm going to start to insert my catheter 2 to 4 centimeters until I see some output. Alright, now I see some straw colored yellow output. I'm taking my syringe and I'm going to insert my syringe into the foley. Okay. Check for placement, inflate my tube. Okay, now I'm going to move my hand off and hold this in place. Remove my syringe. I'm just going to drop it. I'm going to give it a tug. The Foley balloon is holding in place. I'm going to go in 2 more centimeters. And now I am going to attach the bag to the side of the bed. I'm going to attach the line to the patient's leg. I'm going to give instructions on how to ambulate with the catheter in place. Make sure the patient's comfortable and knows what to do if they get up and use a wheelchair. They get up and ambulate, hold it below the level of the waist, below the level of the catheter, so gravity can do its thing. Work. Patient agrees. Everything is okay. The catheter is inserted. I see flow into the bag. I'm going to discard my supplies. See, my bag fell, so I will use this as my supplies to perform hand hygiene. Thank the patients for their help, for their assistance, and I'm going to go now document what I've done. Thank you.